If these teeth were like any other teeth in the mouth, it would usually be quite simple to remove them with local anesthesia only. The wisdom teeth, however, are usually considerably more difficult to remove and normally require a surgical procedure. Therefore, it is very strongly recommended that in most cases the procedure be performed under some form of anesthesia or sedation. There are a number of different anesthetic techniques that can be used to provide a smooth and comfortable surgical experience. Your surgeon will discuss these options with you and will determine which one is the best for your particular situation. Occasionally, a full general anesthetic with gaseous anesthesia may be recommended, just like the one that is administered in the hospital for other surgical procedures. Light sedation, where the patient takes oral medications supplemented by local anesthesia and nitrous oxide gas, may also be recommended in some circumstances. Most commonly, however, these procedures are performed with an intravenous anesthetic, which means that medications are administered through a small intravenous line. You will still essentially be asleep, just as if you were sleeping at night, but unlike the full general anesthetic at the hospital, you are still able to breathe on your own, swallow, cough, and if asked to open your eyes, you may be able to do so, but you would close them again and go right back to sleep, and you would have no recollection of this later. The advantage to this technique is that we can avoid some of the concerns associated with a deep general anesthetic, such as the need for a breathing tube. Yet our patients still appreciate the benefit of being asleep for their surgery. As mentioned previously, your surgeon will determine the most appropriate anesthetic technique for your particular procedure. The medications that we use do an excellent job in producing a very nice level of sedation, so that our patients are essentially asleep for their surgery. One of the beneficial side effects of these medications is something known as the amnestic effect. The amnestic effect means that the patient normally has absolutely no recollection of any events that occurred during the duration of the drug, even if the patient is slightly awake. The other effect of the medication is, of course, the sedative effect, which is what allows you to fall asleep. It's quite interesting to note that in many cases the amnestic effect lasts longer than the sedative effect. What this means is that it is common for patients to report, even though they were wide awake and conversant immediately following completion of their surgery, that they have no recollection of talking to anyone after the surgery, and they often don't remember leaving the office or sometimes even the ride home. The first thing some remember after surgery is being back at home. Now, let's take a closer look at how this intravenous medication is administered. The way the sedation medications are administered is through a small intravenous line, which is usually a small plastic catheter or butterfly needle that is quite simple and nearly painless to begin. While these medications are being given, a small nasal mask is usually placed, through which supplemental oxygen is delivered throughout the surgery. Even though, as we have previously noted, in most cases this is not a deep general anesthetic, we still closely monitor the vital signs during the surgery. We monitor the heart rate and rhythm, blood pressure, and how much oxygen is getting to the blood. The onset of anesthesia is very smooth and comfortable, and once a satisfactory plane of anesthesia has been reached, local anesthesia, or numbing medicine, is administered. The local anesthesia is necessary because, as this is not usually a deep general anesthesia, it would not be possible to perform the procedure without numbness at the surgical sites, and the numbness keeps our patients comfortable when they awaken from the anesthetic. The procedure normally takes around 45 minutes to an hour, but because of the sedative medications, most patients don't notice the passage of time. As a matter of fact, it's quite common for patients awakening from their surgery to ask if we're ready to get started. With preparation time and recovery time, most patients are usually ready to go home approximately 1.5 hours after their appointment time. The only preparations that are necessary for the sedation is that you have nothing to eat or drink after midnight on the night before your surgery. As most of these surgeries are performed in the morning, this means no breakfast on the morning of your surgery, not even a drink of water. Even though this may not be a deep general anesthesia, it is still important that you have a completely empty stomach when you're sedated to prevent the possibility of any stomach contents from coming up and being inhaled into the lungs. You must also have somebody who can drive you home after the surgery, as it is not permissible to drive a car following the sedation.